Viewers, what's happened in the government hospital in Maharashtra's Nanded has stunned the entire country. There have been over 24 deaths in 24 hours between Saturday and Sunday, and this number has now gone up to 31, with 7 more deaths being reported between Sunday and Monday. 16 newborn babies are amongst the people who've died in the hospital. There have been children also in this 16, and the state government has launched an inquiry and has vowed a thorough investigation. After the dean of the Government Medical College and Hospital claimed that the hospital was struggling due to transfer of staff and that medicines could not be procured, the Chief Minister, however, denied any such issue was there in the hospital.
नांदेड़ हॉस्पिटल की जो दुर्घटना है सरकार ने गंभीरता से ली हुई है और सुबह ही मैंने दोनों सेक्रेटरी को बुलाया था, उनसे प्राथमिक जानकारी ली हुई है। अस्पताल में मेडिसिन बिल्कुल पूरी तरह जितना आवश्यक है उतना वहाँ पर था, डॉक्टर और स्टाफ वहाँ पर मौजूद थे। जो घटना हुई है वो दुर्भाग्यपूर्ण है, इसकी जांच होगी। वहाँ पर हमारे जो मंत्री है और सेक्रेटरी है वहाँ पर उनको तत्काल वहाँ पर भेजा है और इसके बाद इसकी पूरी जो आवश्यक जानकारी है वो प्राप्त हो जाएगी।
Times Now did a reality check. We went to the Nanded Government Hospital to take stock of the situation firsthand, and here's what we found. It's appalling, to say the least. The claims of ample medicines being there in hospital stands exposed, as relatives of patients told Times Now that they have to run to private pharmacies even for basic medicines. Furthermore, even for basic medical tests, the relatives have to rely on private facilities outside the hospital, not even to speak about the kind of situation as far as hygiene is concerned. Listen in.
बाहर से चेकअप करके लाने का है।
किस बात का?
वो खून रहता है ना, खून का चेकअप करके बाहर से लाना है।
क्यों इस हॉस्पिटल में नहीं हो सकता है?
नहीं हो सकता बोले, तुम अंदर आके देख सकते हो। हाँ। 31 नंबर में, क्योंकि वो उधर साफ सफाई नहीं ना कुछ नहीं ना। वो डस्टबिन हमारे जब से भर के थोड़ा भी उसमें से निकाला नहीं ना, बाहर लेके जाके नहीं डाला। कुछ सेवा वगैरह कुछ नहीं है, क्योंकि अब हम लेके जाने वाले गांव तरफ।
तो अभी क्या दिक्कतों का सामना कर?
दिक्कत कुछ नहीं, मेडिकल लिख के दे रहे, बाहर से लाओ बोल रहे, एक भी गोली इधर की नहीं मिल रही है हमारे को।
आपको यहाँ पे एक भी गोली नहीं मिल रही है, तो आपको ये
बाहर से मंगा रहे सब औषध। यहाँ पे इनके यहाँ दवाई भी उपलब्ध नहीं है पेशेंट के लिए।
कोर्ट में हमारी थी, कोर्ट में था, उन्हें क्या बोला 1.5 लाख रुपए लगता,
प्राइवेट में
कोर्ट में 1.5 लाख रुपए लगता, ऐसे बच्चों को। हाँ लगता, हमें क्या बोला भाई विष्णुपुरी अच्छे दवाखाना, इसी वास्ते हम यहाँ आए। बच्चा अच्छा था, बच्चे को कुछ भी नहीं हुआ था, उसके डॉक्टर से कारण में बच्चा गया।
And that's not the first time Times found that the situation inside the hospital premises was in need of urgent attention. Garbage lying strewn inside the campus, no drinking water in taps, and even pigs and dogs lying on the floor, posing grave risk to the patients.
Medical negligence, lack of medicines is the issue. Now let's go and try and see what kind of situation is there in this particular hospital in terms of basic facilities. Here they have written that peene se pani, that means drinking water. Does it work? It doesn't. I'm opening this tap, it's not working. If we try the second tap, it's not opening. Third tap is just not present over here. If we go on this side, you can see the kind of dirt present over here. Pigs are lying in this particular area, and which is absolutely filthy and which can cause more diseases to the patients and to their relatives as well, who have been waiting for their patients to get recovered. This particular kind of dirt is being spread all across this area. The dogs are lying, pigs are lying, probably the rats must be dead around this area, and that could also be the cause of certain diseases. So this kind of situation wherein a government hospital is responsible to provide all the basic facilities to the commoners, to the citizens, they are just not able to give it.
Now, there's also an attempt to cover up. Medicines were brought in, secrecy in ambulances, an apparent attempt to show that there was adequate medicine availability. In fact, even despite the outrage over deaths, Shiv Sena MP Hemant Patil visited the hospital to take stock of the situation. A video has gone viral showing the Shiv Sena MP making the dean of the hospital clean a dirty toilet. Unfortunately, that's not the only hospital that is failing the people of Maharashtra. In another district of Chhatrapati Sambhaji Nagar, 14 patients died in a span of 24 hours. Speaking to Times Now, the dean of the hospital, however, maintained that patients who died were referred to from other hospitals in critical state. These stories of hospital horrors just come 2 months after a similar incident in Thane where 18 people lost their lives in just 24 hours. The question is, does the Aam Aadmi deserve this?
संजय सर, घाटी के अस्पताल में जो घटना हुई है, कितनी संख्या में मरीज मरे हैं सर?
मैडम टोटल डेथ फ्रॉम 24 आवर्स जो है तो 14 है टोटल।
14 मौतें हुई है सर, और इसका कारण क्या है?
मैडम ये पेशेंट कोई ये नहीं था, ये सीरियस पेशेंट है। ऑलरेडी 2000 हमारे पेशेंट आईपीडी है, 2000 पेशेंट में से ये है, और ये पेशेंट कोई ऑलरेडी क्रिटिकल थे और ब्रॉड डेथ है और बाहर के हॉस्पिटल से रेफर किए गए हैं हमारे पास।
ठीक है सर। सर, दवाइयों की क्या उपलब्धि थी या दवाइयों की कमी थी अस्पताल में?
दवाइयाँ सब प्रकार की दवाइयाँ उपलब्ध है और कोई भी डेथ दवाई की वजह से हुई नहीं है।
And take a look at why this is such a significant story. Just look at what the patients have been telling us. As far as the medicine shortage is concerned, patients say that they are asked to buy medicines from outside. Times Now has done the reality check, and this is what we found as far as the hospital is concerned. Also, as far as the lack of testing facilities is concerned, we've spoken to patients. They've said that they are forced to have tests done in private facilities. Moving on to the next aspect, as far as this hospital is concerned, the drugs were supplied, as you can see, in an ambulance ahead of Mantri's visit to this particular hospital, and there's no drinking water, no water in the tap when we opened it as far as this hospital is concerned. Look at the unhygienic condition, pigs lying, garbage strewn all over this public hospital. Is this the kind of place that you can go to get treated, or is this unhygienic situation in the hospital just and more deaths as far as this particular hospital is concerned? A story that's been repeated in multiple hospitals across Maharashtra.
You're watching the News Hour at 10, debate number 1 on Times Now, Super Prime Time.
Let's take this across to our guests. Joining us, we have with us Manisha Kayande, spokesperson of Shiv Sena. Asif Bhamla is president of the Bhamla Foundation. With us also is Sanjay Jha, who's an author. With us also is Dr. Asha Mirge, who's an NCP spokesperson. But let me first and foremost go across to Hemant Patil, who's a member of parliament of Shiv Sena Eknath, joining us live from Nanded. Hemant Patil ji, आपका वीडियो जो वायरल हुआ है, आप फोर्स कर रहे हैं डीन को कि गंदे टॉयलेट को साफ करे जी, लेकिन सर ये एक दिन की कहानी नहीं है। जो गंदगी, जो जानवर वहां फैले हुए, जो शॉर्टेज है मेडिसिन की, पीने को पानी तक वहां पे नलके नहीं चल रहे। आप कहां थे सर? आप एमपी है, आपको ये जानकारी नहीं थी? आप क्यों अभी जागे?
सुनिए सर, इसके पहले भी मेरे साथ ये हादसा हुआ है। इसके पहले भी डीन के ऊपर ये कार्रवाई मैंने की थी। मेरे ऊपर एट्रोसिटी एक्ट भी इस विषय में दाखिल हुआ था। मैं हमेशा सरकारी रुग्णालय की स्वच्छता के बारे में हमेशा बार बार मैं विजिट करता रहा हूँ, वहाँ पे बार बार उनको बोलता रहा हूँ। क्यों तो यहाँ जो पेशेंट आते हैं ये गोर गरीब मजदूर लोग जो खासगी रुग्णालय में नहीं जा सकते, जिनकी आयपत नहीं है, ऐसे गरीब लोगों के बच्चे पेशेंट्स यहाँ पे आते हैं। आज हजारों रुपए लाखों रुपए देके यहाँ पे अधिष्ठाता बिठाए है, हेड ऑफ डिपार्टमेंट है। ये लोग कभी वार्ड में जाएंगे नहीं, देखेंगे नहीं, कभी टॉयलेट ब्लॉक्स देखेंगे नहीं, तो कैसा होगा? जिस वार्ड में ये जो हुआ है हादसा, वहां पे मैं आज गया, जाने के बाद वहां के पूरे 6 टॉयलेट्स पूरे लॉक लगाए हुए हैं, पूरा टॉयलेट वहां पे फैला हुआ है, अनाज पड़ा हुआ है, वो गंदगी भी है और बाजू में
पाटिल जी, वहां पे आप डॉक्टरों पे अपना जोर जरूर दिखा सकते हैं, लेकिन सवाल ये उठता है कि उससे बेहतर ये होगा कि आप रूलिंग पार्टी, जो आपकी पार्टी सरकार में है महाराष्ट्र में, उनसे आप कुछ बात करके करवाए, वहां पे लोगों को राहत दिलाएं। ये बजाय उसके आप वहां पे डॉक्टरों पे जाके जोर दिखा रहे हैं। आप अपने पार्टी के नेताओं से क्यों नहीं रिक्वेस्ट करते इसको ठीक करने के लिए?
भाई साहब, ये कोई चैरिटी में काम नहीं करते, लाखों रुपए पगार देते हैं इनको, गाड़ी घोड़ियां देते हैं। आज 240 लोग वहां पे सफाई कर्मचारी है। ये कर्मचारी इन्होंने घर पे रखे हैं, घर के बर्तन मांजने के लिए और धोने के लिए रखे हैं। इनके घर में वॉचमैन।
बिल्कुल सही बात है सर, लेकिन रूलिंग पार्टी किसकी है?
सरकार तो इनको पैसा दे रही है।
आपकी पार्टी नहीं है सरकार में?
अरे रूलिंग पार्टी हमारी है तो पैसे देती है।
तो जिम्मेदारी किसकी बनती है सर?
हमारे पार्टी ने सब इनको दिया है, पूरी यंत्रणा दी हुई, ये लोग काम नहीं करते तो
सर दवाइयां नहीं है,
धड़ा सिखाना चाहिए।
दवाइयां नहीं है,
ये लोग का
जो प्रोक्योरमेंट रूल्स है, जहां हैफकेन को जो इम्प्लीमेंटेशन की प्रोसेस थी 5 महीने तक दवाइयों की प्रोक्योरमेंट में प्रॉब्लम रही है, उसकी जिम्मेदारी कैसे डॉक्टरों की होगी सर? तो आपकी सरकार ही विफल रही है।
नहीं, ये तो वो मंत्री महोदय देखेंगे, लेकिन जो लोकल हॉस्पिटल्स है उसकी
देखेंगे का क्या मतलब है सर? लोग मर रहे हैं और आप कह रहे हैं मंत्री महोदय देखेंगे, देख ही तो नहीं रही है, यही तो दिक्कत है। चार दिन हेड ऑफ डिपार्टमेंट अगर वार्ड में नहीं जाएंगे, 36 लोगों की मौत होती है, कोई देखेगा नहीं, तो इसकी जिम्मेदारी किसकी है? सर आप तो डॉक्टरों को ब्लेम कर रहे हैं, वो तो आपका अधिकार है कि आप कुछ भी कह सकते हैं, लेकिन कहीं ना कहीं सरकार का भी रोल आता है, क्योंकि अगर बजट एलोकेशन अगर 7% से गिरती है जो इस साल में हुई है, तो कहीं ना कहीं सरकार को जिम्मेदारी लेनी पड़ेगी। आप एक प्रोक्योरमेंट के लिए नया एक्ट ले, वो इंप्लीमेंट नहीं होता 5 महीने तक जगह जगह, और ये एक हॉस्पिटल की नहीं है, थाने में इंसिडेंट हुई है, संभाजी नगर में इंसिडेंट हुई है, तो कहीं ना कहीं महाराष्ट्र सरकार की विफलता है ये।
देखिए मैं किसी की बाजू नहीं ले रहा हूं या कोई मेरा दुश्मन नहीं है, मैं गरीब जनता के लिए हमेशा पहले से काम करते आया हूं। इसके पहले भी ये विषय में मेरे ऊपर केस हुए हैं, जिसके पास प्राइवेट रुग्णालय में जाने के लिए पैसा नहीं है, ऐसे गरीबों को बच्चे वहां पे आते हैं, तो ये लोगों 4 महीने से सिटी स्कैन बंद है, ये लोगों की मिली जुली है सिटी स्कैन से, और कौन डीन बिठाया वहां पे? ये डीन जिसकी सीबीआई चौकसी लगी है, जो 2 लाख रुपए की लाच लेते टाइम जो उसको अरेस्ट हुआ था, ऐसा आदमी डीन लेके बैठा है, वो खुद चेंबर के बाहर कभी निकलता नहीं, वहां सुअर घूम रहे, कुत्ते घूम रहे, सब गंदगी फैली हुई है, तो इसकी जिम्मेदारी किसकी है? अगर आप उस मेडिकल कॉलेज के प्रमुख हो तो आपकी जिम्मेदारी है, वो देखना चाहिए, कौन देखेगा?
बिल्कुल सही बात है सर, लेकिन सरकार की भी कहीं ना कहीं निगरानी होती है, मॉनिटरिंग कमिटीज होती हैं, सर्वेज होते हैं, और ये सब सरकार के दायरे में है, और अगर सरकार ये नहीं कर रही तो कहीं ना कहीं इन डॉक्टरों के अलावा सरकार की भी जिम्मेदारी बनती है, क्योंकि ये सरकारी अस्पताल है। एंड दैट्स द क्वेश्चन दैट वी आर रेजिंग टुडे। हेमंत पटेल जी हमारे साथ जुड़ने के लिए बहुत बहुत धन्यवाद। लेट मी टेक across to our guests who are with us. Let me go first and foremost to Manisha Kayande. Manisha Kayande, can Mr. Patil is justifying his strong arm tactics, but can any government deny that there is a serious problem happening? We saw what happened in Thane. We know what has happened in Sambhaji Nagar. And now this is the shocking state of affairs in Nanded. Children are dying, madam. This is the kind of situation that exists.
Well, yes, if you allow me to talk at length, I would be able to communicate my thoughts and the government's view. I also heard Honorable MP Mr. Hemant Patil, who is from that constituency. Incidentally, the ex-CM Mr. Ashok Chauhan is also won several times from Nanded, and he himself, when he had COVID, he chose to come to Breach Candy. Okay, so I don't want to bring in political angles into this discussion, but let me tell you that there were 126 types of emergency medicines available. There is 902 staff available. Out of that, 157 are doctors. Now, first of all, let me put out my thoughts that this incident is absolutely very painful and very shocking, and it should never happen ever again in any of the hospitals, whatever may be the reasons. But coincidentally, I mean, see, out of the 24, 17 were referral patients. I mean, they were terminally ill. They were, okay, Mr. Anchor, please let me finish. Please let me finish. I don't know your name. Please let me finish.
My name is Madhavdas Gopalakrishnan. Madam, my simple question to you is, deaths have taken place. You first are politicizing it. Now you're blaming the patients, saying that they were referral patients. Ma'am, this is not something that is acceptable in modern day India. Should the Aam Aadmi just be allowed to live in this filth and squalor and garbage? There are no medicines. There are no testing facilities. And the CAT scan has been not working for months. Having the doctors is okay for you.
Do you want me to answer? Do you want me to reply?
Please reply, but reply to the poor people of Maharashtra who are facing the brunt of this pathetic administration of hospitals.
Do you want me to reply? Do you want me to reply?
Reply, but do not shift blame. Take onus for the responsibility, Manisha Kayande.
I once again ask you, do you want me to reply?
It's your responsibility, the government's responsibility.
No, if you're going to run away from your responsibility,
There was no shortage
if
of
you're going to run away
doctors,
from your
there was no
responsibility, then
shortage
what
of
should we do?
medicine.
Absolutely.
17 were referral patients and the newborn. They were all below the prescribed weight. They were all critically ill. Now it's a coincidence that all died on the same day. And that is what is heard. That is what is very painful. And of course, I mean, your hospital has your channel has every right to show the visuals. I mean, it is your duty that you're doing. But at the same time, from the government, immediately a committee was set up. Both the ministers, Mr. Girish Mahajan and the other medical education minister, both went there. There is a complete report. I have the authentic report.
Madam,
which
you know, when people die, the reports don't matter. The death should have not happened in the first place. That's the question you need to be accountable for, Manisha Kayande. I want to bring in other panelists now. First, the name of Congress came in, so I'm going to bring in Sanjay Jha and then Sarojit Supariwala. Sanjay Jha, the Congress leader, Mr. Ashok Chavan, also hails from Nanded. The ruling party, Manisha Kayande, is in fact choosing to say that Mr. Ashok Chavan should also share in the responsibility. And perhaps yes, because what has the opposition which has ruled Congress, which has ruled Maharashtra for the past several decades done in the state of Maharashtra is a question that many will ask. One second, Manisha Kayande, let others come in also.
If you are interested in bringing in politics, I have huge heaps to talk. But at the same time, you must...
Madam, you have spoken, let others come in also. We've heard you. Let others come in.
Yeah. Okay, Madhav, can I carry on? I can tell you. It's absolutely horrific, disgusting, and the height of shamelessness that politicians cannot even express remorse, empathy, and sympathy. Can you imagine what the parents of those children are going through? I mean, a loss of a human life doesn't just affect the near relatives. Yeah, madam, will you stop interrupting me when I speak?
Manisha Kayande, you had your say, madam. You had your say. Let others come in now. Others will be forced to lower your fader. Please, don't make me do this. Sanjay Jha.
Everybody is concerned about it.
I mean, Madhav, this is the height of, what I call as being thick-skinned, repulsive, and having no tolerance for listening to criticism when they have failed human lives. Madam, kindly have the decency to listen to other people. Madhav, let me bring to your attention. In Kalwa, 18 patients died within a space of 18 hours. This is not one-off. This is becoming some kind of a trend in Maharashtra. And I can tell you, it will be absolutely shamelessness on the part of this government to try and divert it using red herrings. You are in government. You have a budget for running the public health infrastructure. Do your damn job and stop trying to blame other people for it.
Asif Bhamla, stop blaming others. Stop blaming others, says Sanjay Jha. Why have you failed in your duty to protect the lives of citizens of Maharashtra?
Sanjay,
by providing such poor healthcare facilities.
Sanjay, I certainly would accept the fact that this is a moment to mourn for the families who've lost their loved ones, and certainly swift actions has to be taken, and the government in place is competent enough to look at this. We've already had 2 senior cabinet ministers who have been dispatched to the on-site to ensure that this... Now, there are various aspects to this whole thing. If you give me a 2-minute timing, that there is issues. You see, the only problem here is that incidents like this should teach governments like us. See, today we are in power, tomorrow it could be them in power. So no governments would want incidences like this to happen. I won't even tell the opposition, I won't even blame the opposition when they were in power of whatever
so citizens should just keep dying. Citizens should just keep dying, whoever is in power. What kind of logic is this, Asif Bhamla? Highly illogical. People are dying. This is about Thane. This is about Sambhajinagar. This is about Nanded. And you are saying that people should die, nobody should raise an issue?
The fate of the other gentleman.
What are you saying on national television?
This is a challenging time. No, this is a challenging time, and there are various issues that are coming up. The doctors are saying that the dean claims that there were ailments, there were some snake bites, and that there was some lack medication. So all that now, there is a group of
Mr.
senior
Bhamla.
doctors that have been deputed.
Mr. Bhamla, you know, I really don't know. I really don't know whether it is snake bite, whether it's shortage of medicines, whether it's testing facilities, it doesn't matter. Because the truth is in India, the value of the Aam Aadmi's life is so cheap that even Netas refuse to take responsibility. That is the truth. That is the unfortunate truth. Let me bring in Sajid Supariwala. Sajid Supariwala, do any of these explanations coming from either Madam Kayande or Mr. Bhamla make any sense to you?
I am just asking both of them a simple question. This is a basic amenity of having medicines in the government hospitals. Have they come to power just to enjoy their power and benefits, or they are being provided to the general public as well? Only question is a basic amenity like medicines and hospital facilities are not provided. 14 people have died in 24 hours. It is a shame. It is a disgrace to the state government as well as our state. What are we doing? Are we going to put everything under the carpet? Do you think being like an ostrich and putting your face right in the sand will work? We should all take the responsibility instead of, justifying your acts. We should take the responsibility, Mr. Asif, that this is what we are going to do. Already, first of all, let us mourn for the people who died. There were so many infants in that.
Okay.
Are we not even
Dr. Asha
concerned
Mirge,
about humanity?
before I go across to Manisha Kayande, Dr. Asha Mirge, your quick response to what has been stated here by Manisha Kayande and Asif Bhamla.
No, not at all. To my both colleagues, I will say, they were saying that these much patients were there, this much doctors were there, whether they are competing. First question. Second question, when the dean was there and the doctors were there and the nurses and the workers were there, why there is no water in the tap and why so much hygienic? The pigs were lying all around. That another thing, they said that the patients were referral. Of course, that is a district hospital. That is not a PHC. That is for myself is a gynecologist. I am RMO to one hospital. I am a gynecologist. Referral patients are not sent there for death. They are not sent there for death. And one thing, if these all people, they are blaming the doctors and the dean. What the ministers are doing? What for their minister? What for their elected from the people? What for their doing as a government?
Manisha Kayande, let me bring in Manisha Kayande on that. Manisha Kayande, doctors can be blamed. What about ministers? What about the netas? What about the babus? What are they all doing? They should all be absolved.
Where were all these people? Where were all these people? They were fired in 11 hospitals. In Rajawadi Hospital, one patient's eye was bitten by a rat. In Rajawadi Hospital, one patient's eye was bitten by a rat. There were fire in 11 hospitals during the Uddhav Thackeray government. So are you going to bring in politics in such a sensitive issue? I think is very shameful. Very shameful on the part of the opposition. Very shameful on the part of the opposition.
Well, two wrongs don't make a right, ma'am. Two wrongs don't make a right. The fact is that whoever is responsible for this. Let me ask you a simple question, Manisha Kayande. Is it not a fact that the Maharashtra government enacted the Medical Goods Procurement Authority Act, and the implementation of this was delayed due to committee formation, protocol establishment, etc. 5 months of delays have caused the procurement of medicines by the Hafkin establishment to being purchased. The entire procurement process has actually been delayed. Who will owe the responsibility for that, Manisha Kayande? Simple question to you.
Yes, if you allow me to talk continuously, please.
Go ahead, I'm asking you a question. Please respond.
Yes, so allow me to talk. Don't talk in between. Now there is a authority set up for procuring the medicines. In the meanwhile, the entire charge has been given to the civil surgeon of every government hospital. There is a procedure laid down so that there is no delay. If you remember, during the COVID time, the vaccines were not allowed to be produced by the Hafkins. Who was responsible for that? Who is responsible for the COVID deaths? Who is responsible for the entire scam in the COVID times when the dead body bags were purchased for 6,000 rupees.
Well, I will
each.
only say this, Manisha
So was
Kayande,
that
I
not
gave you a full
shameful?
minute.
Was that not
Unfortunately, all
shameful?
that's happening
So
on this
if you
panel is
try to bring in
whataboutery.
politics,
One can come to this debate and one can choose to take onus and responsibility. While in a democratic system, all are allowed their say. The point is ultimately that when such shocking deaths happen, when you see such squalor and filth, lack of facilities in a hospital that's supposed to be saving lives, but instead if you go there, perhaps your life would be taken in this kind of unhygienic condition, with a lack of any kind of medical care, with a lack of testing facilities, with all that the persons have to do, the families telling us here at times now that we have to run from pillar to post to private organizations outside the hospital to get any kind of hospital and healthcare. Is this what we expect from a district referral hospital? I leave you with that thought, ladies and gentlemen. This evening, I'd like to thank Manisha Kayande, Asif Bhamla, Dr. Asha Mirke, Sanjay Jha and Sajid Supariwala for joining us this evening.